First of all, that pathology is a dependent branch. Like you need to hear from all the doctors, you need to pay commission to them for sending the patients.
Hi guys, and today we have Dr. Malhar Shah, a dermatologist and the son of Dr. Shah, who is the co-founder of Supratech, now known as Newburgh Supratech. Thank you for joining.
Thank you, Shivam, for inviting me. It's a pleasure.
So today we will have a conversation with Dr. Malhar regarding entrepreneurship in this field of medicine. So let's begin. Firstly, in spite of your father running a chain of diagnostic centers across the country, why didn't you choose to join him? Why didn't you opt for MD in pathology?
So there were two reasons. First of all, that pathology is a dependent branch. You need to hear from all the doctors, you need to pay commission to them for sending the patients, and you need to hear bad words from all the doctors as well as the patients. And second thing is, I wanted a name for my brand, like my name, my own name, rather than my lab's name. So I chose a branch which was different than pathology.
Okay. And why did you choose dermatology?
See, so I after my MBBS, I analyzed all the branches and I viewed the scope of all the branches, whether I need to give another NEET after performing my MD or MS. So dermatology was the branch which was well suited for me. It is a risk-free branch basically. So I chose dermatology. Plus aesthetics, I was keen in aesthetics.
And according to you, which out of the two specializations, like pathology, dermatology, which will prosper more in the future and why?
See, it is not which branch will prosper more, because every person might have went to laboratory at some point of time in their life for performing any diagnostic test. Plus, they might have went to any dermatologist because everybody faces issues like acne or dry skin or something like hair fall, something like that. So it depends on who is running the branch or test, and who is running the branch, who is running the laboratory, and who is running the clinic of dermatology. It depends on that.
Okay. And what are your entrepreneurship ideas? How are you planning to establish your clinics, or what are your ideas?
See, so entrepreneurship is much more about your my idea, my vision. Then I form a blueprint. I find investors. Then I should know that where I am lacking, where I possibly go wrong, what is my backup for that. So entrepreneurship is all about that. It is an integration of basically finance and productivity and all the resources. So I want to establish a brand for myself, a quality brand basically.
Okay. And as an entrepreneur, what is your mindset regarding your goals? Are you ambitious? You're optimistic about it? What is your say?
See, I am very much ambitious about my goal. I have started, analyzing all the things like that, company valuation, company profit, that book profile of the company, then EBITDA ratio, and profit to earning of the company. What is the SOP of the company? How should you establish one clinic after another clinic? So most probably I would establish a brand for myself, and I would like to expand it on my own in the next 5 to 10 years.
Okay. And does the field of dermatology require a lot of clinics?
It depends on individual. See, if you are running one clinic, then also it is fine. If you are much more ambitious and you want to expand, then you should establish multiple clinics in multiple cities, so as to create a wealth for yourself as well as a name for yourself. So it depends on an individual's ambition.
Okay. And as an entrepreneur, where do you see yourself in the next 5 years?
See, I can't seem to gauge it right now, but as I told you that I would definitely like to start one clinic. Then I would like to establish a quality control of my clinic. Then I would like to collaborate with other people who are performing well in their clinics, and in that way I would like to establish at least 2 to 3 clinics in the next 5 years.
Okay, so really good luck for all your goals, and I hope you'll reach them very soon and super soon, and I can interview you once again. So it was great talking to you, Dr. Malhar. Thank you.
Thank you, Shyam. Thank you.